All right, in this video we have two cases. The left case represents a patient with ARDS or acute respiratory distress syndrome. This patient has very low compliant lungs or very stiff lungs, very stiff alveoli. The right-sided case is a case for a patient in an asthma exacerbation. This patient has very tight or narrow airways. In both of these cases, when the patients are on mechanical ventilation, you will notice increased airway pressures. And so, for example, in this first case, you see that the airway pressures are in the 50s. If you look here, the peak airway pressure is 57 centimeter of water. In this case, again, the peak airway pressures are elevated. The peak pressures are in the 50s. It's reported here to be 50 centimeter of water. So it's important to differentiate between the two cases in terms of diagnosis, and also the treatment is gonna obviously be different between the two cases. And so one thing you can do to be able to differentiate the two cases is to do a plateau pressure. So again, remember, checking a plateau pressure is gonna give you an assessment of the alveolar pressure. If the alveolar pressure is normal, then that means that the increased airway pressures are needed to overcome the resistance of the airways. And so this is the second case, the case of the patient with an asthma exacerbation. If the plateau pressure is high, then that tells you that the patient's alveoli are very stiff or stiff lungs. And so this is the case of the patient with an acute respiratory distress syndrome. So let's go ahead and check the plateau pressure. Again, remember, in order to check a plateau pressure, the patient should be well sedated, relaxed, no intrinsic respiratory effort. You do check the plateau pressure by checking an inspiratory pause. So you click inspiratory pause, and then you wait until you get that flat line. I'll let go now, and then I'll pause the simulation. So note that flat line represents the plateau pressure. It's a flat line, and hence the name plateau. The airway pressures here are reported to be 47 centimeters of water. So that means in this instance, the alveolar pressure here in this patient, or the plateau pressure, is 47 centimeters of water. So that means that the plateau pressure is high, and that means that the patient has low compliance of the lungs or the alveoli. Again, this is a case for a patient with acute respiratory distress syndrome. Let's check the second case. I will do the same. I will click end inspiratory pause, and then I will wait for the next breath to be delivered. And again, you see that flat line. I will let go, and then I will pause the simulation. I will hover over that plateau, and that's a plateau pressure. So the airway pressure is reported to be 12 centimeters of water here. So that means that the plateau pressure is 12 centimeters of water. So that's quite normal. So that tells you that the fact that the patient has an increased airway pressure in the 50s has to do with increased resistance or very tight airways. And again, remember that the second case here is a case for a patient with an asthma exacerbation. Okay, so I think that's all for this video. Thank you.